Do you know what the difference between an opiate and an opioid is? Because in this video, we're going to be discussing some different facts about the differences between the two, opiates and opioids. This is your daily dose of mental health. Before I go any further, please like and subscribe to the channel. Ring that bell icon. The subscribe button should be in that bottom right-hand corner. This is going to be a quick video. Let's just jump right on into it. This is the differences and similarities between opiates and opioids. All right, so as you can see right here, hi everyone, opiates versus opioids. So what is the differences? First off, opiates. Well, actually, before I go any further, opiates and opioids can be used. They're used interchangeably. A lot of times, though, it's when somebody uses the term opiates or opioids, they typically say opioids because there's a lot more of them are actually used in the clinical setting. More so as opioids. So let's get right on into it. So the difference is opiates, they're derived from the plant matter essentially. So it's natural, not synthetic. Also, main key is derived from poppy right here. So a lot of times back in the day, for example, opium, way back when, the Chinese in particular really loved smoking opium. They do it at ceremonies, and it was a very common drug that people got addicted to, and it still, and especially in China and Afghanistan, is used to this day. Morphine, codeine, and in particular, real quick, as an opiate, heroin. Heroin is the most common opiate today on the market, and what I mean by the market, the street market. Now, why do you think that might be on the street market? It's because it's very cheap. However, can lead to, in extreme situations, and it's very easy to happen, overdose. Cheap, very cheap, but equals high chance, I'm just going to put the arrow, of overdosing. Also can be mixed with fentanyl. Opioids. So big difference, opiates, naturally derived from the plant matter. And just because something is natural, that does not mean, obviously, that it's good for your health. A lot of times we think of stuff that is natural as being good. Cocaine is natural for the most part. It comes from the plant, but it's addictive and very dangerous and can cause problems with your heart rate. And it can cause all sorts of issues with heart enlargement, cardiovascular disease, heart failure, the list goes on, enlargement of the heart. Heroin, same thing. So the next time somebody says, oh, just because something is natural, though, that means it's good for you, don't listen to that, because technically heroin is technically natural, however, typically laced with things like fentanyl, but heroin actually falls under the opiate category, pure heroin. Number two, here we go. So opioids. So both, as I said, both these are used interchangeably a lot. Opioids are not derived from plants. So not derived from the plant matter, they're synthetic. Very, very common ones typically used, which I listed, there's a lot more, is hydrocodone, oxycodone, hydromorphone, known as Dilaudid. Hydrocodone is typically, it'd be like a Vicodin. Oxycodone, Percocet. They're used, the words generic versus the name, not really a big difference. I'm just how I'm stating it. The big thing I want you to take away from this is I'm not bashing opiates and opioids. This video is just what are the differences. This can also go under the next time if you're prescribed, let's say you break your arm, or you have your wisdom teeth removed, or you have a very debilitating disease. Make sure to ask, when you're being prescribed something, ask, is this an opiate, opioid? It's just things to know, and the doctors should be telling you, or the nurses. Let's go into the similarities real quick. Both classes are considered narcotics. Number two, both groups are addictive and can lead to dependencies. Anything that is addictive, and you've taken it for, typically at least a month or so, will lead to your body having a higher tolerance And from a physiological standpoint, you will develop a dependency issue, which I do want to bring up. There's a difference between addiction and dependency, because physiologically, we would all develop a dependency if we took these long term. And number 3, both can be used for extreme pain and disease. Once again, as I said, I'm not bashing opiates or opioids. They are used. They have their uses for extreme pain. For example, my grandma, she's had a stroke. She had a stroke 20 years ago. She's used hydrocodone, oxycodone, different things for her strokes. Also, long-term chronic disease, or even things like stage 4, stage 3 cancers. So there is a wide range of uses for them. It's just good to sometimes know the differences and what some of the similarities are, meaning just because you're prescribed something, for example, that's natural, like an opiate, it does not mean that, it's not addictive. For example, as I said, like heroin technically is an opiate. And typically most of the stuff on the street, like heroin you buy, it is very cheap to buy because it is laced with something like fentanyl. Fentanyl is being laced with plenty of things today, even benzos. A very good resource for anyone in case you were ever given a medication if you bought something off the street and you want to know, if you want to actually know if it's legit or not, you can look up on your phone, like pillwizard.com. There's a lot of different sites where you can look up literally if you get a pill, if it's real or if it's fake. Also, this is just the educational aspect that I wanted to get into, just the basic differences and similarities of what opiates and opioids are. In the next video, I will be discussing, in particular, and it will cover both opiates and opioids. I'm going to mix them together. In particular, cover ones that are commonly prescribed, which would be things like I'll cover hydrocodone, oxycodone, and morphine, and give you more education on, once you've developed if you've developed a dependency to it and you're taking it long term, what are common practices on ways to get off of them, how to get off of them the right way. So the next video will be education in regards to why you are addicted, what's going on, why you became addicted, why they're hard, why you just can't get off them cold turkey a lot of times, and why you're having withdrawal symptoms. So that's what the next video will be covering, is what is going on essentially in your body when you are detoxing. And one last thing real quick I wanted to cover. A lot of times today, most opiates and opioids today even opiates, have a synthetic compound to them. A lot of times, like hydrocodone and even oxycodone, they have a dual where they're partially natural, partially not. I was reading over 100 different opiates and opioids that are obviously derived from the plant, but also have compounds that are synthetically made in the lab. Watch out for the next video on the dependency aspect and the withdrawal of these medications, and education in regards to what to ask when getting off of these. Please like and subscribe. You should please thumbs up, hit that subscribe button in that right hand corner. I love you all. I typically don't do any editing. I just like to throw knowledge out there, being an RN. So I love you all. Please leave a comment as well. Peace and love to everyone. Look out for that next video in regards to the detox of opiates and opioids and different education that you should know about these substances when going through a detox. Peace, love. This is your daily dose of mental health. Talk to you later.